important is it to have this clinic or service open here in Thunder Bay?
We're extremely excited that it's able to open, even though it will only open for, or there's an exemption for a short period of time. The first drug strategy for our community recommended looking at feasibility of these types of services, and that was endorsed both by the Board of Health and City Council back in 2011. So it's been a long process for our community to get to this point. So we're very excited that we'll have the initial stages open and then need to continue to explore how future applications get processed in Ontario.
Do you think it's likely that the site will be able to continue past December 31st?
Well, I'm hopeful, certainly with the Minister of Health pausing services and reviewing the evidence and doing consultations across the province about the efficacy of these types of services, and then coming back and saying that we will allow the 3 locations that were asked to pause to continue, and have offered a new model to for community organizations to apply under consumption and treatment services, that they do see value in it. Certainly evidence points to the need in our community, and we've known that for some time, and that was part of the reason for investigating feasibility of these types of services, doing a feasibility study in the community, and then working with several community partners to apply for either the full supervised consumption service or through the overdose prevention site, the former models that you could apply for.
Not to put you on the spot, and I know you probably don't have exact numbers, but can you give us an idea of, say, how many overdoses the city has been experiencing in the last year, maybe?
Well, the data isn't out for 2018, so unfortunately that is a significant issue that across the province we're struggling with, is getting real-time data. The last data that we were able to access is the first quarter of 2018, and it indicated that there were, and note these are still, I can't remember what the word is called, preliminary. But there were 12 deaths in the first quarter, which is actually above, if you look at the year prior, above normal average. And it appears across Canada that overdoses continue to increase. And so it really is imperative to start to embed these services in the community and provide timely access to overdose prevention supports.
Overdose prevention sites sometimes receive pushback in the community. People see it as just giving drugs to people, so on and so forth, and they see, police is playing more of an important role in getting the drugs off the street. But can you just tell us the role that these sites actually serve for the community?
Well, certainly there is pushback from community, but there's also a lot of support in the community. There's often fears about, increased difficulties in the neighborhoods, but all the research indicates that there's actually less public injecting, public use of substances, the less discarded needles at the community level, which is also an area that the community is concerned with. And it provides a point of access for individuals who don't typically engage in other services. And so while the province really indicates that they want a strong emphasis on providing linkages to treatment, this is the opportunity to do that, to have a first point of contact with individuals, and to offer healthcare linkages to housing support, social assistance, and navigating through the treatment system within the community.